What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Oh, you know what I'm talking about. That patient or family member, could be either, that patient or family member that does not know how to stop talking. One reason or another, they seem to jump from subject to subject to subject to subject and turn a 2-minute update into a 10-minute dissertation. Now, I understand patients cope with stress in very different ways. Some patients, their way of dealing with the scary events going on in the hospital is to talk. Pretty sure that there are patients out there that feel very lonely, and I'm not here to dispute that. But you can't have too much of a good thing. So I thought I would give you 5 escape tips. 5 tips to help you try and escape from that room. 5 tips to help you escape the dissertation. Number 1, you gotta know the patient. You should know ahead of time if this patient is a talker, if they're a walkie-talkie. Most of the time, your coworkers will give you the high sign, or it'll be said in report that, you know what, this patient is a talker, or this family member is a talker. Don't let them corner you in the room, because you'll never get out alive. Yes, these are the things that nurses talk about. So if you know ahead of time that this patient has a tendency to chew your ear off, then you better have a backup plan. You better have a backup plan. You better have a rescue line. A rescue line. You gotta have a coworker that's willing to come into the room and say, hey, you know what? I need you for a second. Or have that coworker give you a call on your phone so that it rings. Or have sent you a text message so that you have it ring. Or if you still have a pager, like I do, have somebody page you. Just make sure you have a backup plan. Number 2, always have the exit within view. Always, always, always have the door to the patient's room within view. Within your peripheral vision. So that if you find you're being pulled into the abyss and you keep an eye out to who's crossing, walking down the hall, walks in front of the room. Hey, Joe! Hey, whoa, whoa. You can throw out a lifeline. Hey, Joe, about that thing we were talking about. You gotta have a plan. Hey, Mary, did you take care of that thing that you need help with? Gotta have a backup plan. Number 3, pay attention to the direction of the conversation because sometimes you can anticipate an exit strategy. Kind of difficult to give an example, but you have to figure out where in the conversation you need to exit to go take care of some sort of requirement or need. Someone could say something about their vital signs or their pain or something about their heart rate, and you could interject or segue. You know what? I don't know the last time that I gave you that medication to help with your heart rate. Let me go check on that. Out you go. Number 4, pay attention to the room itself and the layout of supplies. Is there something that looks like it needs replenished? Something low? What about the patient's water? Do they have enough water in their water pitcher? Do they have enough glasses of water? Would they like ice in their water? Do they have the utensils they need? They look uncomfortable. Maybe they need a second pillow. And if you could always play the, you know what, you look cold. I should probably get you another sheet and or blanket and or pillow. You get my point. Number 5, and this is really not a tip. This is just good old-fashioned being outright honest and saying to the patient, you know what, I have other responsibilities I have to take care of. Is there anything else you need right now? Can I come back? How about if I come back and check on you in so-and-so minutes? You're going to have to sometimes just cut them off at the pass and tell them, listen, I know that you have concerns, but I have other patients I have to take care of. I have a phone call to make. I have meds to give. Oh, there's somebody coding down the hallway. You gotta just be blunt sometimes. You need to be tactful. You don't want to be rude, but you need to be honest and tell them, I got to go. Care to add any escape plan tips? What has worked for you? Leave your comment down below. You know your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.